See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist Shauna Butler.
Access, convenience, affordability.
There's about 51 million surgeries done in this country every year.
We know that at least 1 in 5 adults has a diagnosable mental health issue.
There are maternal health deserts out there.
Many schools of nursing have discontinued perioperative nursing.
We need more people working with folks with depression, with suicidal tendencies.
There's ramifications of putting off or delaying surgeries.
We need people learning more about the LGBTQI plus and gender expansiveness and how to work with that population.
So with over 91 million Americans lacking access to primary care, who is going to meet that need?
Mental health nurses are in the right position right now to help alleviate some of that pain.
There is no other area of nursing where the patient is so dependent on nursing as in the operating room.
I don't think that in general, people know what we do.
I think the general public has impressions of what they see on TV and not an accurate picture.
Nurse practitioners can work in many different areas, patient population-wise, acute, ambulatory, women's health.
Several of our members have worked with law enforcement to help educate law enforcement how to approach folks having a very severe mental health episode.
Nurses really are the eyes, the ears, and the body of that patient while surgery is taking place.
We believe in a continuum of wellness.
We coordinate care really well.
Advanced practice nurses prescribe and do psychotherapy.
We want our patients to be engaged and empowered to make decisions about their care.
Welcome to See You Now. I'm Shauna Butler. Headlines across the country, indeed across the globe, point and speak to the critical role nurses play in the health of our communities, our counties, and our countries. And increasingly, those headlines convey the alarmingly high rate of nursing vacancies, shortages, and departures, and just how debilitating these losses are in providing for a population's full range of healthcare needs. Often, these headlines and stories speak of nurses in the aggregate, generically as a single category, referring with broad strokes to the numbers of nurses needed without much detail or discussion about the expertise, specialty, location, or scope needed, as though nurses and their skills and experience are easily interchangeable, when in fact, that is not remotely the case. Health systems across the world have felt the strain of ever-increasing demands, complexities, and additional challenges of multiple health crises. To meet these demands, nurses have stepped in and stepped up. Today, there are 28 million nurses and midwives across the globe caring for older adults, responding to the staggering rates of mental health issues, halting and preventing the spread of infectious diseases, vaccinating millions of people, reducing maternal and infant deaths, and keeping people safe before, during, and after surgery. And yet, despite being in high demand and playing critical roles in managing an impressive array of clinical, surgical, and public health needs, nurses' expertise is often unrecognized, underutilized, and not well understood or accurately portrayed. In this episode, we explore, through the musings of experts and champions, 3 distinctly different nursing specialties as a way to understand the breadth, depth, and expertise of nurses, the incredible rigor and training required to become a discipline expert, just how varied nursing specialties are, and how incredibly vital each nursing specialty is.
I'm Leslie Oleck. I'm a psychiatric and mental health nurse, and I'm president of the American Psychiatric Nurses Association, which is 15,000 members strong, fighting suicide every day. I started out in cardiac care nursing, loved cardiac care nursing, but what I noticed during that time was the families were always in distress. Many people died. So there was a lot of grief. And I thought there's got to be a better way to help people get through this really hard time. So I decided I was going to get a master's degree in psychiatric nursing and started practicing as a crisis interventionist and psychotherapist, and worked in a private psychiatric clinic. Then I also did teaching. I worked at a university and enjoyed very much working with students. It's just always been a joy to get them enthused about psychiatric nursing, because I don't think there's any setting that a nurse can go into where she or he doesn't need relationship skills, knowledge about the brain, the kinds of things that the psych nurses do the best. I don't think that in general people know what we do. Many consumers and families don't realize that psychiatric advanced practice nurses prescribe and that advanced practice nurses do psychotherapy. They don't realize that psychiatric nurses can use motivational interviewing and do it well, and can do it in all settings. And it's not only education of consumers, but it's education of legislators and policymakers and people who can help fund mental health facilities, mental health programs that can be run by psychiatric mental health nurses, because we have the expertise to do just that. Many RNs work in inpatient facilities, but they can also be found in occupational therapy, doing screening tests for drugs, helping people adjust their daily lives if they've got a diagnosed mental health condition that seems to be interfering with their work. They could refer to an advanced practice psychiatric nurse who would see patients in an outpatient setting, could be on an inpatient setting as well. And we have doctorally prepared nurses doing research with PhDs, they teach. So we have a wonderful variety of varying degrees to hopefully meet the mental health needs of the citizenship. There are over 125,000 psychiatric mental health nurses in the country, and that was in 2018. The advanced practice nurses in psychiatric nursing, the number has gone up since then. It's very encouraging to me to see that more nurses want to do the work that is required to assist the citizenship of this country. We know that at least 1 in 5 adults has a diagnosable mental health issue. We are seeing that the suicide rate and the suicide ideation rates are going up in children as young as 10. It just tears my heart out to hear that. There's been an epidemic of suicide for many years, but because it's a mental health situation, I think it wasn't as well attended to as many other issues have been. And with COVID, things are coming to the forefront that were sort of simmering behind the scenes prior to that. And mental health nurses are in the right position right now to help alleviate some of that pain. What mental health nurses are really, really good at is working with the patients and working with the families, whether they've been diagnosed with autism, whether it's that they have an anxiety issue, whether they are living with depression. How can I keep this person engaged in their own care? That's what psych nurses do, is we get the families involved as well to benefit the folks that we're working with. Several of our members, of APNA members, have worked with law enforcement to help educate law enforcement how to approach folks having a very severe mental health episode. The person may not be reality oriented and may be thinking that the officer is part of a hallucination. And that would be very frightening to any person that doesn't have any kind of background in mental health and know that that person is simply defending themselves from what they think is going on. And knowing that we can help the law enforcement officers and even firemen, because sometimes the firefighter is the first responder. And so they come into this situation that might be really scary. But if they are assisted to know how to approach a person that is in that frame of mind, it turns everything around. This is typically not a criminal situation. And fortunately, even if a person has a gun, there can be an intervention to avoid anybody getting hurt. And that's what we love to see, is when we help people work with folks to get them to a higher level of functioning safely. Psychiatric nurses can work as directors of nursing, and that's really a nice combination, because then those nurses will be paying attention to the staff in the hospital, and patients get better care when the staff feel respected, when the staff feel valued, and we want to encourage that in every kind of medical setting as well as in a psychiatric setting. And in fact, we have consultation liaison psychiatric nurses that can be hired by a hospital and go to medical units and talk to people that may seem that they're becoming more depressed than they usually see after a surgery. We're everywhere. We believe in a continuum of wellness, and this is a big topic for us right now. We look at social determinants of health. We want to help the lifestyle of the patient as well as the immediate crisis of the patient. And if we can do that by using other referral sources, by working with the families, we want to do that. And looking at diversity, equity, and inclusion, and the social determinants of health, and how that influences the health disparities, especially in such things as opioid use. We need many more experts in psychiatric nursing going into addictionology, going into opioid use disorders and substance use disorders of various kinds. We need more people working with folks with depression, with suicidal tendencies, which any depression can lead to. We need people learning more about the LGBTQI plus and gender expansiveness and how to work with that population. We need people specializing in childhood developmental disorders, such as autism, such as attention deficit and hyperactivity, because that's a tricky diagnosis. I'm always very encouraged when anyone in a public forum talks about mental health. The Surgeon General is fantastic to want to go into that. We are all excited about that in APNA, because what we want to do is put forward the mental health of the country. And mental health nurses love working with our patients. We love our patients, and we love working with our patients, and we're especially thrilled to see them get better. Often people think, well, folks with mental illness don't get better. They do. They do. With treatment, people can get better. We need all the help we can get to do that, because the mental health needs of the country are huge. APNA would like to see more awareness about mental health and about mental health needs and about the services that psychiatric mental health nurses can bring to the table. We'd especially like to see all psychiatric nurses be able to practice to the full scope of our education and clinical training. We are so excited that there are 26 states now that do allow full practice authority, and our huge wish list would include full practice authority in every state. It would help the citizens of this country so much.
I'm Linda Groah, Executive Director and CEO of the Association of Perioperative Registered Nurses. We are an organization of 40,000 members. Our mission and vision is on being the indispensable resource for perioperative nurses in education so that they can care for patients and also other healthcare workers. Perioperative nursing is the continuum. It can start from when the surgeon makes the decision to do surgery into the pre-op clinic where there are the tests that are done prior to surgery, during surgery, the intraoperative piece, and then post-operatively when the patient is recovering, the immediate post-op, which is usually going to be right in the recovery room. But it can also be extended until the patient returns to their normal work and or life. So it has a very broad continuum. There's about 51 million surgeries done in this country every year. Larger procedures, more extended procedures are done in the operating room in a hospital. And then ambulatory surgery, there are some freestanding ambulatory surgeries and some that are connected to a facility. And then we have surgery that's done in doctor's offices. There is no other area of nursing where the patient is so dependent on nursing as in the operating room. They are totally dependent on the nurse to be their advocate. So they really are the eyes, the ears, and the body of that patient while surgery is taking place. The anesthesiologist focuses on the heart and lung, the surgeon on the incision site, but it's the perioperative nurse that is really looking at the patient holistically and looking at all of the potential ramifications if anything's going to go wrong in that surgery or untoward events, and be ready to respond, whether it's to get blood, to get medication, to get additional help. That is the role of the perioperative nurse in the operating room. There's usually 2 nurses assigned to every patient. One of the nurses will come to the pre-op area and get a report on you as the patient. The pre-op nurse would have an opportunity to, just before surgery, either 24 hours or even just the day of, to do an assessment of the patient, to do a care plan, to find out nutrition, use of drugs, alcohol, what their exercise regime is, all of the things that they need to know preoperatively about that patient that would potentially impact the patient during surgery. And also talking about any anxieties that you have. Anxiety is a really important part of that pre-op assessment. In the operating room, I want to describe what you're going to see and hear there. It's going to be cold. You'll see some trays of instruments in the room. There may be some people moving around the room, but it's all part of the team that's getting ready to care for you. And then we do what we call a timeout, and that's just to verify what the surgery is, the side, the site, the right patient. Your identification will be clarified several times during the course of getting ready for surgery and then moving into actually the operating room and back onto the table. All of that is to make sure that we have the right patient at the right place at the right time. The surgery progresses, and then at the end of the procedure, the anesthesiologist and one of the nurses will take you into the recovery room, where they will give a report to the recovery room nurse. It's what we call a handoff. So they will basically give a report and hand you off to the next nurse who will be caring for you in that post-operative phase. It's all very well coordinated, and it is the nurse who controls that environment. There's one nurse who is not scrubbed and sterile at the sterile field, and we call her the circulator. But she really is the person who would, if there's an emergency, would be the one who would act quickly and get whatever we need to have to stabilize the patient or maintain the procedure. So teamwork in the operating room is absolutely essential. You have to be able to converse, and sometimes without saying anything. We wear masks, and sometimes it's all eyes that tell the story. And the perioperative nurse establishes a strong understanding between the nurse and the patient, a strong bond that is probably at no other point, because the patient is awake and then they know they're not going to be awake and they are dependent. And we encourage the nurses to stay by the patient until they are asleep, so that there is familiarity. There's somebody here that is taking care of me. If something happens, one of the OR nurses will actually either come out to see the patient's family or call if they have access to a phone. So it's a connection. It's a bridge to what's going on. So they know that there's a connectedness there, that there's somebody there that is taking care of that patient. I think the general public has impressions of what they see on TV and not an accurate picture. It is not a real romantic place to work. Life and death occurs in the operating room. So from that perspective, I think that they have an unrealistic picture of what the operating room nurse is all about. But it's interesting that once a patient or a family undergoes surgery and they experience the empathy that the perioperative nurse has for the family and for the patient, their ideas of what it's about is forever changed. During COVID, there were hospitals that reduced their surgery schedules, and they were doing only urgent or emergent surgeries, and there is a backlog of procedures. For example, I was talking to a nurse, and she said that their backlog of cataract surgery, which is a relatively, no surgery's minor, but less invasive than if you're sitting there with potential cancer, but they're backlogged. They don't think they'll be back into rhythm until September, October. And in the meantime, cataracts can be very dysfunctional to the individuals. They could sign the wrong documents. They could, if they're trying to drive, have accidents. So there's ramifications of putting off or delaying. And we are finding that many schools of nursing have discontinued perioperative nursing. And that isn't recent. That's been evolving over several years. But certainly as we come out of COVID and the number of nurses that are retiring, the number of nurses that are leaving nursing or going into a much less stressful area of nursing, we are finding that there is definitely a real shortage of perioperative nurses. There is a brain drain. There's no question about it. The operating rooms that will be successful will be looking at their current staff and seeing, where do we need to focus? How many do we have that we think will be retiring in the next 5 years or next 2 years? And start looking at grooming nurses. So in some cases, it really means you have to double up on your staff so that you have those nurses that are ready to come right into the workforce. We have at AORN been fortunate to partner up with Chamberlain University. And we have a course that we call Introduction to Periop. And we have partnered with Chamberlain. They're just finishing their first cohort, getting ready to start their second one. And they have 23 campuses across the United States. And their goal is to put this into all of their campuses. So we're just thrilled because this second cohort, they have over 180 undergrad nurses interested in going in to take this course. Of that first cohort of 100, 80% of them have decided they would like to go into periop. We have had several schools of nursing now call to inquire to see what they need to do to put this into their curriculum. And this whole project that ANA has on reimagining nursing. And this is one of the programs of reimagining nursing, is looking at specialty organizations as well as the education and the service, that triumvirate of coming forward with a unique, innovative way to offer this to student nurses. If you want to have an exciting opportunity, it's in perioperative nursing. There are so many changes that are occurring in the way we care for patients. Perioperative nursing had its foundation on best practices. So it was what was the predominant way of doing everything in the operating room, whether it was positioning, whether it was medications, whether it was how we treated patients. And in 2012, we made the decision that we were moving to evidence-based practice. So there is a sound evidence base to perioperative nursing that defines nursing, and it defines the quality of care that patients get based on that evidence. That's how we move forward. We were only doing totally invasive and now minimally invasive, and probably soon invasive to the point where the robots are very active in the operating room. So there's a lot of technology that changes, and perioperative nursing is right there in the middle of all of those changes, developing care plans on how to care for the patients with the new technology. Virtual reality simulation centers has allowed us to go places we've never been before and to continue to provide care to patients in many new ways and give a lot of people hope that they did not have hope before through the surgical interventions.
A nurse practitioner is a registered nurse who has pursued advanced graduate education training and has ultimately completed a national board certification in their particular area or specialty. I am April Kapu. I am an acute care nurse practitioner, and I have the absolute honor and privilege to serve as the president of the American Association of Nurse Practitioners. The American Association of Nurse Practitioners, or AANP, represents over 355,000 nurse practitioners across the United States today. We have many resources and supports in many areas, but specifically related to practice, education, advocacy, research, leadership. I've been a nurse practitioner for many years. I worked in an intensive care unit as a nurse, was very fortunate to be able to work with nurse practitioners in that unit, and realized that I wanted to pursue a doctorate degree in nursing practice. I specialized in acute care, so I was a nurse practitioner in the cardiovascular intensive care unit and was able to serve there and care for many patients, work with many members of the healthcare team, but also able to understand my connection with the broader spectrum of nursing and advanced practice registered nurses. An advanced practice registered nurse can be one of 4 different specialties. It can be a nurse practitioner, nurse anesthetist, a nurse midwife, or a clinical nurse specialist. Very different roles, but all under the umbrella of advanced practice registered nurse, requiring that advanced education and training and national board certification in that particular role. And then I've also been an educator, and I'm faculty now. I'm a professor of nursing and associate dean for clinical and community partnerships. And I love that role because I'm able to work closely with nurse-led practices in our community. It's just been a fascinating and rewarding career all along the way, and certainly an exemplar when you're talking about the many different opportunities that there are in nursing. I have really been able to explore a lot of those different opportunities and just have been so grateful for that. Nurse practitioners can work in many different areas, patient population-wise, acute, ambulatory, women's health, psychiatric, mental health, so many different types of clinical areas. We can also serve as educators, as researchers, as advocates. We can specialize in health policy. We can lead in health systems and own our own practices. So there's so many different types of nurse practitioners. Nurse practitioners are educated and trained to diagnose, to prescribe, and that's both pharmacologic and non-pharmacologic therapies. They're trained to order diagnostics, test, interpret those tests, make diagnoses based on the assessment of all of the data, the physical exam, their past medical history, a review of these tests, these diagnostics, and the results of those, make diagnoses and come up with treatment plans. We're educated to educate. We spend a lot of time speaking with our patients and families. We want our patients to be engaged and empowered to make decisions about their care. And then another thing that we do that often gets overlooked, but is fundamental to us as a nursing profession, but specifically to nurse practitioners, is we coordinate care. We coordinate care really well. We have this much more contextual type of dialogue with our patients to better understand what we're talking about right here in the clinic. Are you going to be able to do this? Is this something that you agree with? And is this something that's going to be very doable for you? We don't always take into consideration the social context. These are the things that as nurse practitioners, we really delve into because we want you to have a healthier life. And so we ask additional questions to make sure that we're both on the same page in terms of what and how and where we will access all the resources needed to have a healthier life. We have national standards for accredited education. So our education is very rigorous, but it's focused on the particular track that we have chosen. But you practice in a particular state. If you're within the United States, the states oversee the licensure authority. And so what you can do with your license is very much regulated by the state. So if a patient comes to see you as a nurse practitioner in Texas, it's going to be a little bit different than if they come to see you in Kansas or New York, which are known as full practice authority states, meaning that in those states, those nurse practitioners have the licensure authority to practice to the full extent of their education training. That's a huge step forward as the nurse practitioner profession has evolved. We've evolved over the last 50 or 60 years to get to where we have standardization in education and training. We also need to update our laws in each state so that we can practice to that full extent. It's about access to care. And if there are barriers there that limit access to care, then that's really doing a big disservice for the consumers in that state. So in 26 states and Washington, D.C., nurse practitioners have full practice authority. What have we seen in those states? We have seen improved patient outcomes, and we follow these states every year after they go to full practice authority. We follow patient outcomes. We follow the workforce numbers. Do they have an increase in nurse practitioners in those states? We follow where they're going to work. Are they truly going to work in rural areas or areas that have historically been known as provider shortage areas, where people who lived in those communities lacked ready access to care? And we have seen Nevada, Nebraska, Arizona, all of these states that have gone to full practice authority, we've seen an increase in the workforce and more nurse practitioners moving to work across all settings, and in particular in rural care areas. I use Nebraska as an example. When they went to full practice authority, 25 of their counties that had historically been known as provider shortage areas had an increase in NPs living in those areas and working in those areas. And that brought a tremendous amount of access to care. When we talk about access to care, I often love to share the story of Loretta Ford. She's the absolute pioneer when it comes to nurse practitioners. She was a pediatric nurse, and she and a physician, pediatrician, Henry Silver, lived in Colorado back in the 1960s. And at that time, they were experiencing, and they say this, a public health crisis. Now, doesn't that sound very familiar? And they said, there are so many people that live across rural Colorado that lack access to care, meaning they have to somehow figure out how to get to a clinic, a hospital, emergency room. And they felt strongly that nurses, with this specific additional education and training as a nurse practitioner, could fill this space and meet this need. And this is really where we began to see the evolution of nurse practitioner practice, and year over year, consistently shown high quality outcomes of care that have demonstrated that nurse practitioners are very effective in care. They have high patient satisfaction rates. They have consistent quality patient care outcomes. They have had a huge impact on access to care. So now we've seen this evolution to where now we have national consistent standards for education and training. And then we've seen this huge growth in the nurse practitioner specialty, and to where we're at 355,000 nurse practitioners in the United States today. So just in the US alone, 355,000, grown at a rate just last year of 9%, estimated to continue to grow 9 to 10% every year. It's the number one job, according to the U.S. News and World Report, the number one job in healthcare today. And why is that? Because we are meeting a need. We have this simultaneous shortage of physicians, especially in the primary care area. So with over 91 million Americans lacking access to primary care, who is going to meet that need? So the conversation has gone from what is a nurse practitioner? It's shifted. So now we're hearing more, I want to be seen now. And I want to be seen by a qualified practitioner. Because in today's world, you don't want to hear, let's make an appointment. You can get in 6 weeks or in 6 months. We want to be seen now. So nurse practitioners create options. Patient satisfaction in nurse practitioner care is at an all-time high. Last year alone, there were 1.06 billion visits to nurse practitioners. And in those states, those 26 states in DC that have full practice authority for nurse practitioners, individuals that live in those states have full and direct access to NP care. They have more options. They have more access to care in their communities. They have a choice. I'd like to see a nurse practitioner for my diabetes management. I'd like to see a women's health nurse practitioner to talk about my care. They can make that choice to see their provider of choice. That's huge. Patient choice is important. Access, convenience, affordability. These are factors that we're considering as consumers of healthcare today. That's important to know as we're talking about the other states that have not updated their laws. And we've seen this particularly throughout the pandemic. Access needs are huge. We can't have a conversation without talking about the pandemic these days, but it was so impactful, so tragic in so many ways, but also created a space for innovation. People were having symptoms, needing to be seen in the hospital and at home, and telehealth. All of that really pushed us into this space of innovation that we'd never been in before. And so we did see states say, what can we do in terms of leveraging the nurse practitioner? These states didn't expand the scope of practice. They allowed the nurse practitioner to practice to the full extent of their education and training, not beyond, but to that full extent. They removed those barriers because people in the community needed to be seen. We needed to set up temporary testing sites in the community, drive-throughs, seeing people in community centers, churches, wherever we could provide that care. On the inpatient side, we were expanding our EDs, building makeshift EDs. We were expanding ICUs. We were doing hospital to home and seeing COVID positive patients in the home because they couldn't get out. It was just amazing how we just really pushed those boundaries. Many states put into place executive orders to relieve some of those barriers so that nurse practitioners could practice to the full extent of their education and training. And as a result, 4 states over the last 2 years have moved to full practice authority. That's Massachusetts, Delaware, New York, and Kansas. They moved to full practice authority. They saw what it did for the residents in their state. Why not allow nurse practitioners to do what they were educated to do? Let me just give you an example of my own experience in the pandemic. Early on in March of 2020, we were putting up temporary clinics, and nurse practitioners were staffing these clinics to make sure that patients who had signs and symptoms of COVID-19 could get tested and treatment if needed. But because in Tennessee, where I live, we're a restricted practice state, we have a requirement to have an exclusive contract with a physician. And that physician must do a retrospective chart review of patients that we have provided care for. So that can be a month later or so that they do this chart review. If we would not have had those executive orders relieved, we would have literally been pulling physicians out of their practice, putting them in an office, reviewing charts all day, every day, because of the sheer volume of patients that we were caring for. Now, we were educated and trained to do what we were doing, but because of the restriction of that retrospective chart review, requiring a physician to review 20% of our charts, that would have pulled physicians literally off of the front lines. So we were so grateful for those executive orders so that we could actually provide care in a pandemic. This concept of full practice authority impacts the nurse midwife too. So a certified nurse midwife, again, a registered nurse that has pursued graduate and many times doctoral level education, national board certification to be a certified nurse midwife. In order to practice in the state, they have the licensure to practice based on the state's rules and regulations. Those are outdated and very unnecessary barriers to care. There are maternal health deserts out there where moms and children and moms that lack prenatal care, that's so vital prenatal care. If they don't have that, we have higher infant mortality rates, huge, and we need more access to care. And this is where midwives have come up and they've really met this need throughout the years. But as we saw in the last 2 years, it literally took a pandemic. To really see the huge need for immediate access to care. Immediately, we were all able to provide the highest level of care. We were all able to work to the full extent of our education and training, all working together. And so that's what we need to see. Now, if I could say anything, we need all of our healthcare clinicians, MDs, DOs, NPs, CRNAs, all of those acronyms, all working to the top of their education and training.
Acute care nurse practitioner April Kapu is currently serving as the president of the American Association of Nurse Practitioners, commonly known as AANP. Before April, we heard from Linda Groah, executive director and CEO of the Association of Perioperative Registered Nurses, identified as AORN. And we opened the episode with psychiatric and mental health nurse Leslie Oleck, who is currently serving as the president of the American Psychiatric Nurses Association. Deep appreciation to our episode storytellers for sharing their deep experience, substantial insights, expertise, and enthusiasm for their favorite nursing specialty. Each of them believers in the training, specialized skills, and readiness of nurses to be drivers and partners in better health access, safety, quality, equity, and choice for every citizen. Over centuries and decades, we've experienced that nursing as a profession is essential and critical in maintaining and protecting the health of the world's populations, and often are the only healthcare provider available in a region. At 59%, the world's 28 million nurses represent the largest segment of the global healthcare workforce. Nurses are an important and influential force for public health, and in many places play advanced, highly skilled roles that fill in the missing pieces of care, such as providing primary care, mental health care, maternity and newborn care, and surgical anesthesia. And nurses are key to achieving access and equity to affordable and quality care. And yes, the dire headlines are accurate. There is a shortage of nurses, one that is exacerbated by a global pandemic, years of systemic underfunding in healthcare, and one that is projected by the International Council of Nurses to reach 13 million globally unless drastic and long overdue actions are taken. In addition to the shortage in numbers of nurses, we also have an expertise shortage. When nurses leave the workforce, they take with them millions of years of clinical acumen, highly specialized skills, expertise, and institutional knowledge gleaned over a career of caring for people. So it's vital that workforce planning, investing, and policy decisions include not only the numbers of nurses needed, but also the specialty skills they'll need to meet the broad range of health needs we will each have over our lifetimes. So the next time you hear a conversation or a story about nurses, hopefully you'll ask, what nurses exactly do you mean? As we head into summer, we're going on the road to the Aspen Ideas Health Festival, where we'll be contributing to and leading the consequential conversations in health and keeping you updated along the way. We'll be back at the end of the summer with all new episodes. For See You Now, I'm Shauna Butler. Thanks for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.